Hi, this is Dr. Burke-Galloway, author of The Smart Mother's Guide to a Better Pregnancy, blogger, and OBGYN physician. So today I want to talk a little bit about my favorite subject, pregnancy. I've been on a couple of websites for pregnant women, and what amazes me is there's one question that has popped up more often than I thought it would pop up, and that is, am I pregnant? Many women are very concerned about whether they're pregnant because they're actively trying to get pregnant, and then you have the population of women who don't want to be pregnant, and for some reason they think that they might be pregnant and they're anxious to find out. So one of the questions that was on one of the websites was a woman who said, I had my period 2 weeks ago and now I'm bleeding. Is this implantation bleeding? Am I pregnant? Abnormal bleeding, breast tenderness, back pain are really not the most common sign of pregnancy. A missed period is the most common sign of a potential pregnancy, because if you're someone who got their period like clockwork and all of a sudden it's 1 week late or 2 weeks late, you need to do a pregnancy test. Now, there are home pregnancy tests that can be done. You can certainly buy the commercial brands, but you can also buy the dollar store pregnancy test that's sold in the family dollar stores, and it is just as accurate. There are scientific studies that show that test, the dollar test, is just as accurate as some of the commercial tests, but I leave that up to you. How soon can you find out if you're pregnant with a home pregnancy urine test? The answer is between 5 to 7 days, because what the pregnancy test is doing is it's measuring the amount of hormone, the pregnancy hormone that's being produced in the urine. A blood test can be done, a pregnancy blood test can be done 1 to 2 days after you become pregnant. Why? Because the blood test doesn't need as much of the hormone as the urine test does. But the flip side is the blood test is also more expensive, and even if you go to a healthcare provider, they're usually going to want to do a urine test before they do the blood test. Some people say, well, can I find out if I'm pregnant by doing an ultrasound? Well, the ultrasound is not going to show the pregnancy until roughly 5 to 10 days after conception, after you become pregnant. And the hormone level has to be, and I want you to remember this number because it is important, the hormone level of the pregnancy, also known as beta-HCG, that has to be at 1500. If it's not at 1500, the ultrasound is not going to show a pregnancy. On the flip side, if your blood test has a hormonal level of greater than 1500 and you have an ultrasound done and that ultrasound does not see a baby, then one, your blood test needs to be repeated, because if it's a healthy pregnancy, the numbers should be doubling every 48 hours. The other thing you have to be concerned about, if you have a positive blood test and it shows a number over 1500 and they don't see anything, is it an ectopic pregnancy? Is the pregnancy in the tubes? So those are things that are very, very important that you need to remember. So, wrapping everything up, are you pregnant? The only way that you're going to really find out is do a urine pregnancy test. And let me just add one more thing before we close. If you do a urine pregnancy test, a home pregnancy test, you still need to confirm that test with a healthcare provider, because sometimes you can have a false positive test. So, until next time, this is Dr. Burke-Galloway, author of The Smart Mother's Guide to a Better Pregnancy, hoping that you've enjoyed this video. You can certainly ask me questions at the bottom. This video is going to be on YouTube. You can hit me with some questions and I will certainly answer your questions for you. And if you haven't picked up a copy of The Smart Mother's Guide to a Better Pregnancy, I hope you do, because it's helpful, and a healthy pregnancy doesn't just happen. It takes a smart mom who knows what to do. Until next time, have a good day.